Welcome, everyone. With me to my left is Manisha Guia. She's the managing partner at Fem Health Ventures. And to my right, my other right, is Maria Villasares. She's a founding partner of Steel Sky Ventures. And ladies, I'd love if we started with what put you on this path? What made you decide to go into venture capital and women's health in particular?
Sure. Well, thank you. Thank you for this opportunity, and excited to see all of you here today. I'll tell you a little bit about why I'm doing this and why I started a fund focused on women's health. So in brief, my 24-year career has all been as a healthcare investor. I've been investing in healthcare for 24 years. And I knew early on that it was what I wanted to do. I went to Wharton as an undergrad, I went to Harvard for business school, and I worked at some of the leading multi-billion-dollar venture capital, private equity, and hedge funds. And during the course of that time, as a healthcare investor, I found that again and again, women's health was underinvested and overlooked. So I wanted to do more around women's health specifically. So that's the first reason. The second reason is more personal, the reason I'm doing this. So I have a healthy daughter, and she was born at Columbia University in New York City, and I had major complications with the delivery and almost didn't make it. So in brief, I had an emergency C-section on a Sunday evening, a few days before Christmas. And she was born and healthy, but I didn't feel so well afterwards. And it wasn't until the next morning that my OB walked in and realized, after taking one look at me, that I had been bleeding internally the whole night and they had missed it. So she rushed me into the OR and brought in 3 additional surgeons. And they spent 2 hours with me open, trying to find the source of the bleed. They couldn't find it. So she had me taken to the ICU, and I had 10 transfusions of blood and platelets. And the OB told my husband that she didn't think I would make it to the next morning. So then at 1 a.m., she broke protocol and had them bring my newborn into the ICU to see me because she didn't think I'd be around much longer and wanted me to at least have a picture with my daughter. So it was really bad. Fortunately, in the subsequent hours, my body started catching up with the bleed, and I was able to recover. And coming away from that experience, I felt very fortunate to have made it through. And unfortunately, there are many, including in our nation, that are not so fortunate. And I felt the way for me to have the most impact, having been a healthcare investor throughout my career, was to create a vehicle focused specifically around women's health. And that's what I created with Fem Health Ventures. So what we're looking to do is back innovators who are developing companies specifically within women's health. And we'll talk about it later. But what I would say is we feel there's a substantial opportunity to do more in this category and have an impact and bring forward extremely compelling innovations to the broader market. And we're excited to be here to participate in that.
So Maria, you don't have to come up with as dramatic a story.
Right?
Tough act to follow.
There's usually 3 ways people get into this, right? They come through the investing route, they come through the experience route, or they come through the entrepreneurship route. And Manisha described the first 2, and I came through the third, the entrepreneurship route. So I've been an entrepreneur operator my entire career. And as I started getting into the investing side from the entrepreneurship side, I really wanted to invest in female-led social enterprises. So I joined an angel investing group, and I was looking at all of these amazing entrepreneurs that were innovating. And all of the women in the group wanted to invest in beauty or retail or food. But I saw this segment of entrepreneurs that were creating really scalable, game-changing innovations in women's healthcare. But because healthcare is so layered, it's very complex, a lot of angel investors just don't feel comfortable investing in healthcare. But I did. Having come from running and helping to run one of the largest dermatology clinics in the US, I understood healthcare. I understood technology, how technology can enable healthcare, and how we needed to provide quality care for all Americans, just not the top 1%. And so as I started investing in these women-led ventures. And it was really interesting. I said, how am I getting into these amazing deals with these really smart founders with these really scalable companies at really well-priced valuations. And then I looked to the data, and the data showed that less than 2% of women were being funded, but even less was going to women's healthcare. And so that's when I decided to knock on the doors of a couple of VC firms to see how I could continue to invest in women's healthcare. And my knock on one door, close in my face. Knock on another door. Somebody tried that in the 80s, it didn't work. Knock on another door, we don't do that here. Knock on another door, it's so niche and so small. And I was just like, this is really interesting.
Yeah, because half the population is kind of niche and small.
So I was like, listen, if 50% of the population is men, 50% of the population is women. Why is this 50% so much smaller than this 50%? And I just couldn't wrap my head around it. And so that's when I decided to take my grandmother's advice. And if you don't see it, build it. And so that's what I did. So I started Steel Sky Ventures, which was one of the first women's health funds. And in 2020, during the pandemic, I just knew it didn't matter if there was a pandemic going on. Women are still having babies. Women are still going through menopause. Women are still being denied access to care. And so we started Steel Sky Ventures, and our goal with Steel Sky Ventures is to invest in companies creating better access, care, and outcomes in women's health.
You know, one of the interesting things is when I get pitched stories about women's health, it's usually, years ago it was always about fertility, which continues to be an important issue for a lot of families. You know, and obviously the maternal death rate in this country is something that remains a concern, really a problem. Last year, suddenly menopause was hot, and I say that with the pun intended. But something that I could definitely identify with. But it seems as though that's all people think about women's health in terms of just our reproductive cycle. And I'm glad that it's gotten broadened to menopause. But is it still a little too narrow when you talk to people about investing in women's health?
Absolutely. So for Fem Health Ventures, we developed a framework that we published a number of years ago, and this is based on investing in healthcare for so many years. And it's a 3-part framework, thinking about women's health beyond just reproductive health, as you were saying, or bikini medicine, as some people call it. So basically, we think about women's health across 3 categories. Number 1, conditions that affect only women. Number 2, conditions that affect mostly women. And number 3, conditions that present differently in women. So only women includes reproductive health, for example. Mostly women includes things like autoimmune disease and migraines, which impact many more women than men. And differently,
and Alzheimer's.
And yes, exactly. And then, and differently in women includes things like heart disease, which can present differently in men versus women. So when we're thinking about women's health, we're not thinking of just reproductive health. We're thinking about a broad set of categories where both men and women can present differently with the same illness, and the same illness could have a different treatment based on whether it's a man or a woman presenting. Now, a really great recent example is actually COVID. So if you think about the J&J vaccine, it came out just 2 years ago in 2021. And if you recall, it came to market, and very soon afterwards, it was taken off the market due to a dangerous, potentially deadly blood clotting condition, specifically in women of childbearing age. So here you have COVID, which impacts men and women. The disease impacts both men and women, and a treatment which is in this case a vaccine, which has a potentially different impact in men versus women. These are the types of things we want companies to take into account as they're developing their products. And we're excited to support those companies as they bring their products forward and take those differences into account and therefore develop better treatments.
Maria, you talked about trying to launch this during COVID, and certainly with George Floyd, all of a sudden companies were much more cognizant and really tried to step up, including investors, and say, we really need to be more equitable. We saw a big jump all of a sudden in women's health tech, but the environment has changed over the last year. There haven't been as many exits. It's certainly much more tough with the Federal Reserve raising interest rates, the business side of it. But it's made people a little more cautious. What are you seeing now? And is it still harder for a woman's health firm, and a women's health tech firm in particular, to garner that attention?
Yes. So yes to all of the questions. It's really difficult for any woman, first of all, to raise money as a fund manager or a founder. But what I found during COVID is that a lot of the best companies continue to get funding. We have a rock star founder sitting in this room today, Karine Karmi, and her company is Origin, and they do pelvic floor physical therapy for women. They've continued to thrive during this downturn. And so what we found is kind of a flight to quality. The best companies are still getting funded, and the other companies are still available for point solutions that can be rolled up into these larger platforms. So even though not all of these amazing companies will survive, they can survive in one way or another. One of our companies, 28 Health, has made 2 acquisitions of companies that weren't able to get funding. We're kind of a community in the women's health investing market, and we want to make sure that companies that are creating access and better care are still able to thrive regardless of if they're overlooked for investment. And so that's one of the things that is really important to Steel Sky Ventures, is to keep great companies that have great outcomes in business. And so we're starting to see a lot of roll-up and consolidation. I thought this roll-up and consolidation would happen 4 to 5 years from now, but actually, due to the downturn, it's happening now, faster than ever before. And we are seeing these mega platforms get built. And those platforms, like Origin, they are the umbrella pelvic floor health platform, right? So she has brick and mortar locations, in-clinic locations, virtual offerings for national virtual offerings. And within that platform, we can have pelvic floor devices and other products and other products that can alleviate some of the symptoms of
Can
pelvic
you work
floor
with
challenges.
a menopause company?
Yes, exactly. My company, MIDI, is a virtual first menopause clinic, and it's a clinic for women 40 plus because we age out of the hospital system, right? After you're 40, after you're of reproductive age, it's kind of like there's nothing for you. But we understand that we still have health challenges after we give birth, and that there's so much more of our life that we're going to live, and we need the support of our health systems. And right now, it's just not there. So companies like MIDI offer a platform for women to get hormonal care, natural care, nutrition, and iterative care, because throughout your life, you're going to go through menopause for a very long time, right? And so you're going to need different iterations of care through that. And so it's an iterative care platform that you can keep coming back to and getting the solutions that you need.
I wonder about who are the investors these days, because I've noticed that hospitals have venture funds, or they have venture funds with a bank or with a venture capital investor. So where is it that you're finding funding these days? And are there certain things that they're clued in on that they really want? You talked about point solutions. It seems to me people are moving away from single point solutions.
And that's why at Steel Sky, we only invest in the platform plays, because as you said, it's hard to get to IPO. So if you invest in the platform that gobbles up all the point solutions, that's $1 billion platform that you can IPO or sell to a larger health organization. For instance, we're working with Wellstar Health System in Atlanta, Georgia, who's also sitting in the room today, and they've made a commitment to health equity. And so they're investing in companies like that Steel Sky invests in, and funds like Steel Sky, because they want to create better access and care for all Americans, especially people of color, which are very expensive to the healthcare system, but also we've been denied care for so long. We don't trust the healthcare system. We don't engage in it in the same way that others do. And so hospital systems like Wellstar, hospital systems like MultiCare has invested in us, and we're really excited. Eli Lilly, they all understand health equity, and they all understand who is thinking about women and who is thinking about people of color. There's not many fund managers that look like me and that look like Marcus and that look like Catherine. And we're all talking about health equity. We're all doing the hard work to find these companies that are going to change the face of healthcare for people of color in this country.
Mina, how important is it to have one of these companies actually IPO, or, how important is it to have the Bumble or the Meta or the Amazon of healthcare be one of these women to kind of validate the investment community?
I think that for the investment community, what's important is investment returns, and you don't need to have sort of a Meta or a Bumble in order to have strong investment returns. It's a matter of coming in at a compelling valuation and having an exit that gives you a substantial return. And I would say that in this market environment, and investments, the investment environment goes in cycles. In this market environment, we feel very well poised to take advantage of compelling entry points and make investments that will lead us substantial upside in terms of returns.
So where are the exit points?
So the exit points right now that we're looking at are largely acquisition based. So we look at specific solutions that make a lot of sense in a larger company. So let me give you a very specific example. So if a company's selling a product that applies to, is sold through OBGYNs are the ones who are doing the writing the prescription, it can be rolled up into a larger company that already has an OBGYN sales force. It makes a lot of sense. It provides economies of scale and reduces costs. So that's the type of company that we're generally looking for. We're looking for companies that make sense in a larger company. Some of these over time, depending on what the market environment looks like, could end up being a platform and become an IPO type option. But that's not specifically what we look for when we're looking to invest in a specific company.
Do you still find when you go into, you said knocking on doors, and not to pick on California, but I gotta imagine there are more people that look like you and more women like you, but when you go to Sand Hill Road, it's got to be quite a hill to climb to get them to open that door, or is it better?
Well, we're focusing on 3 key targets for our LPs because as a part of the Steel Sky ecosystem,
LP, explain that.
A limited partner, which is an investor in a venture fund. And so a lot of the people on Sand Hill Road are other venture funds. And so for us, we really want to create an ecosystem that can support our portfolio companies. So we focus on healthcare investors and financial investors and insurance investors. So Blue Shield of California is an investor of ours because we know to provide access, we need our portfolio companies to have healthcare coverage. And so they help us understand what companies are the most viable to be in the Blue Shield portfolio and to get coverage. Another one is Eli Lilly. So they are a healthcare company and they're trying to really focus on health equity. And so that's where we focus too. And they're also looking to, buy these companies and buy solutions. So we go right to the acquirers and we want them to be on our cap table. We want them to be investors in our company because then we're all aligned. And so that's what's really important to us. And then we have the banks that are also invested in us, Bank of America, JP Morgan, and those types of companies because they're going to be doing
no longer Silicon Valley Bank.
Yeah, no longer Silicon Valley Bank, but they were fans of us as well. But what those companies, those firms do is tell us what's going on in the IPO market, who's looking for acquisitions. So then we have a front row seat to understand, our company can fulfill this need. And then, like Manisha said, most of our companies are going to be acquired. And so they are really keeping us on the pulse of the trends that are happening in the market, how to navigate a downturn in the market, and then how to get our companies to a successful exit.
I joked about Silicon Valley Bank, but there were a lot of companies that turned to them because a traditional bank may not necessarily want to take that much risk. How has that impacted the environment, given what we saw with 3 of the banks that were most involved in this community go down this spring?
Yeah, I think that's been a significant challenge for the entire venture capital ecosystem, for fund managers, for companies, and everyone involved around it. So that came just in the spring. And what I would say there is after Silicon Valley went down, that impacted interest in investing in venture capital. It impacted the ability for venture capital firms to get capital, to find a bank that would service their needs. And all of that sort of put together created a challenge in the venture capital industry. And it's part of why the venture capital funding environment is where we see it today. So very specifically, it's harder for companies to get funded. because people, just the general public, I would say, sense is that venture capital is risky, it's challenging, and look at this big bank that was sort of in the center of all of it and unfortunately was not able to proceed. So I think that that has added to the challenge in the market environment. But on the flip side, as investors like Maria and I, we're looking to help these companies to deploy capital and bring exciting technologies forward so we can continue to do that work. And in some cases, it means that we get even more compelling entry points, which is great for our investors.
You know, if I were a founder, I would certainly want to be making something or developing something that I know will have longevity and will get picked up and covered. But, you know, I talk to friends who are, venture capital is always about, hey, let's push you, let's get you to develop things. I talk to friends who have been physicians and their practices are bought up by private equity, which creates a whole different environment because then it really is about the bottom line much more directly, much more immediately. And they talk about how it's a blessing and a curse because sometimes it could give them more money to expand, but the curse is then it also puts a lot of pressure on that bottom line. How do you help your companies manage and prepare for these kind of transitions where you're starting from the hopeful stage, growth stage, let's try to blaze new paths to suddenly you need to make this work?
Well, I think it's really important, the investors you have around the table. You hit the nail on the head. Some investors are not aligned, whether it's in PE or whether it's in VC. So putting together a syndicate of mission-aligned investors who all agree upon the trajectory of the company, the exit of the company, and the strategy of the company is very important. And so we like to invest with a cohort of people that do have like-minded goals. And so that's why we invest with Jumpstart Nova, we invest with SIA Ventures, we invest with FemHealth Ventures, we invest with RH Capital, because we are all aligned in the way we see the world and what we want for the world. We don't want these companies to spend all of this time creating these great solutions just to get bought and put on a shelf. Right. We do not agree to that. Even if the outcome could, create great returns, we believe that we can still generate great returns, but also have the impact that we want to see in the world. That's why these founders are creating these companies, because they want to change the world for the better. They want to improve the lives of women around the world, and we're here to support them, and we're going to find investors that believe in what they're doing to support their efforts.
Manisha, are we finding that in maternal health? Because it's astounding to me in this country. It makes sense that women who have less access, who are poor, that they would have worse outcomes. But here's someone who had coverage and you still didn't have, a great outcome necessarily.
What I would say there is I think that there's has been not enough innovation within maternal health. So Maria and I are co-investors in a company that's targeting that specific area. So let me be very specific. So many of us in the room maybe have been, had children or been in the labor room. There's a fetal heart rate monitor that goes across the belly of the laboring mother. And that fetal heart rate monitor came out in the 1960s. That was before the FDA even had a process for approving medical devices. So it never got approved by the FDA. It came to market because everyone thought machines will make our lives better. And the vast majority of births in the US are done using the fetal heart rate monitor. Now, up to 80% of the data out of that fetal heart rate monitor is inconclusive for the OB. The OB does not know if the fetus is okay or not okay, and they have to rely on a number of qualitative factors to make the determination. Should I rush in for an emergency C-section, or can I take my time? And by the way, emergency C-sections result on many more complications. Mm-hmm. It's high stress for the clinician and the care team, as well as the patient and the family. When I told you about my story, it was after an emergency C-section. Now, the question is, are we doing a lot of unnecessary emergency C-sections?
Yes, we're doing 300,000 unnecessary C-sections a year. I will quantify that and tell you yes.
Yes, exactly.
And that's why we needed to invest in this company.
Yes, and this company, so Maria and I are both investors in this company. So this company came up with a different way to monitor the fetus. So this is an example of where we can see more innovation. The technology is out there. Very specifically, the technology that we invested in is based on tech that's all over, which is the simple finger pulse oximeter. It's almost ubiquitous. We've all used
Right.
it during COVID. And that optical technology is what they're applying to the belly of the laboring mother. So
But does that work on women with darker skin?
Yes, so they
That's
do
why
have
we
it.
invested, because we care about women with dark skin.
Because when I looked at pulse
Absolutely.
oximeters, they're like, well, I don't know if it'll work
Yeah.
on you.
Yeah. So they have a model where they're able to make it work in all different skin colors. And the idea is you shine a light through the mother's skin to the fetus and figure out the fetus's oxygen saturation. This way, the clinician has a second quantitative metric to rely on in order to make the determination, do I need to do an emergency C-section to save the fetus, or can I take my time and do a C-section, which results in lower rates of maternal morbidity, mortality. So the idea is with this product, you can put a dent in maternal morbidity and mortality by removing the number of unnecessary emergency C-sections. So what we're very excited about is this new technology. So I think in terms of addressing maternal morbidity and mortality in this country, there are many factors involved, including low income and access to care, but it's also
many C-sections.
too many C-sections. And the third is innovation. We really need more innovation. This is a space that's been ignored. We have not given our care teams the appropriate tools. Look at all the other areas within tech, within healthcare. They've had so many more advances, and we're excited to have the opportunity to help identify and bring forward some of these compelling technologies.
And Bertha, you mentioned health equity. The founder of this company is a founder of color, and that's why it's really important to spread out who gets funding, because different entrepreneurs are thinking about different communities, and that's why a lot of medical devices and things don't work for people of color, because there wasn't a person of color, there wasn't somebody in the room advocating or even asking the question of if it works. And so that's why it's really important for everybody to take meetings with everyone and invest in all types of entrepreneurs.
I'm going to open it up for questions. We have a few minutes left, I'm sure. Let's see, we have someone in the back. 1 second while they're getting the mic over there. I want to ask one more question while we're getting to hers. My university, I remember the endowment investment officer had said that he didn't care what happened once Uber went public because they had invested at the beginning. And so for our endowment, that's where we ended up getting the payoff. How do you get more people into those early stages where sometimes the payoffs are better rather than waiting until buying an IPO?
It's really the return profile that each fund is looking for. Each fund is going to have different.
Well, I think about equity in there. How many women know about being able to invest in something like this?
Well, it's groups, angel groups like Golden Seed. Sarah Clark is sitting here right now. She cared about aging. I have a company that I invested in, Concerto Care, that's for at-home senior health. And so she found a community of people that were investing in things that she wanted to invest in. And that's what's really important, finding like-minded groups that you can invest with so that you can be putting your dollars for the change that you want to see in the world.
Do I need to be a gazillionaire? Do I need to be, No. Yeah.
No, exactly. Most people don't even know that they're accredited investors. And I think that I don't want to have to spout all that out, but go and look up if you're an accredited investor. And I think you'd be surprised. So many people are like, well, I don't have a lot of money. I don't have millions of dollars. You don't have to, but you can if you start investing in venture early, and we can change that.
Because I would imagine if you had more women investing,
Yes.
the more women, the more people of color investing, the more that pushes to think more broadly.
And it's education. When people are investing in things that feel good and are for good for the world, they think that they should be giving that money to charity. But we're here to show...
Which is not a bad thing.
It's not a bad thing, but we're here to show that you can also create good in the world and you can make money so that you can sustainably keep giving. Because if we're not billionaires, then our angel checks will run out. And that's why I started a fund, so I could have a sustainable way to continue to give and continue to invest in the companies that I want to see in the world.
All right.
To hear from you all. Can you tell us the name of that new technology, and is it FDA approved?
Oh, the one that I was speaking
Radiant.
about?
Yes.
Radiant Oximetry is the name of the company, and the product is not FDA approved yet. So it's
They're in the
What's the
pipeline.
path?
So we're still in the trial stage, but the early trials are very good.
Perfect. And gentleman here in the front, and then the lady over there. Hold on 1 second because of the feed. They want to get you on the mic.
So are you seed or Series A investors broadly?
So we're focused largely on Series A and Series B.
Okay.
We'll occasionally go earlier or later. So we're not bound by a letter. There's three key criteria we look for, which are not.
Okay, so
And I'm seed A.
Okay, so my question is, there's no shortage of money out there for good companies and good ideas. What's your edge? Like, why do founders want to work with you? How are you helping to grow their businesses?
Sure. So our specific depth of expertise within women's health is what attracts founders and helps them and makes them want to work with us specifically. So we have been cut into many oversubscribed rounds, for example. Even in one case, there was a round that was oversubscribed, closed, and they reopened it to let us in because of our depth of expertise within women's health. We've developed a network of relationships, so across the board in terms of companies, key opinion leaders, health, health systems, insurance plans and so forth that are all aligned in terms of this vision. And having that type of insight as part of their cap table makes a lot of sense for entrepreneurs.
There's a young woman here in the middle. Can you point to any of your successes?
Well, I was going to answer that question.
Yeah.
I don't want to toot my own horn, but if you want to hear why founders want to invest with me, we have Karine right here, and she'll tell you why.
Okay. There we go.
This was a real setup.
Yeah, right? You get your layup.
Were you a plant?
I have to say, so Maria invested in our company in 2020. That was, at the beginning of the women's health is hot phase. And you've been by far one of the most important, impactful people on our cap table, even when the dollars, they've been growing with us over time. But, from connections to vision alignment. And I think to not have to explain the problem so many times over and over again when there's such an obvious need, I think is really, really critical. So, Maria, you rock. Thank you.
Thank you. My name is Eliza Alsis, and I'm currently a graduate student at Harvard. And
We won't hold that against you.
Oh, no, thank you. In one of my courses, I actually learned that in the past decade, there's been 400 maternity care wards that have closed predominantly in Latino and Black communities. And as a result, we've seen a slow increase now in birthing centers, and there's one in Boston that's also starting up. And so I was curious to know what your companies are doing to invest in birthing centers as well as midwifery to, again, expand access to care and meet women where they are.
So we've invested in a doula care platform called May. It's specifically for Black expectant mothers, right? Because we know that they're having the worst health outcomes. And so we feel like being able to provide advocacy and education and health tracking is going to be really important.
But does that provide access when it comes to time to
Yes.
deliver? Do you connect them with a physical doula?
Yes. So it's virtual and also in person. And so when they go to give birth, they have this person, this trusted person who's going to be their advocate and their voice in the room.
I would agree with Maria. I don't have anything to add.
And we have a question in the back, and then this gentleman here.
So my name is Nancy Mandujano, and I am a founder. I'm building a SaaS product to help support independent abortion clinics. And my question to y'all is, how niche is too niche? Thus far, I've been bankrolling myself because I figured I would not get investor interest since my focus is independent small clinics right now. So I just wanted to see what your thoughts were. How small is too small?
So we don't really have a market opportunity size minimum like some other venture capital firms have. It's a matter of having a clear business plan that can take you from where you are today to a substantial upside opportunity. So even at the right valuation, even a small market makes a lot of sense. I mean, I've been investing for decades, as I mentioned, in healthcare, and you look at something like the orphan drug market. One might have thought 20 years ago that people would not be excited about orphan drugs, that it goes after a small patient population in the United States, but actually they are some of the biggest dollar size amounts of spending,
Because also those drugs are so
so expensive. Exactly, and they're very meaningful treatments for tough conditions. So I'm very happy, and I feel like we as a country have done a great job in terms of trying to target these orphan markets and orphan orphan diseases specifically. So what I would say is there's not a market that's too small. It's a matter of, can you approach that market with a business plan to provide upside? And there's no, large market definition that's required.
But something like a rare disease is one thing. I wonder, given the climate right now, how difficult is it for an abortion startup and to get, it's such a fraught issue. We also don't know what's going to happen with the courts, although I would imagine the Fifth Circuit will rule and then we'll end up going to the Supreme Court. There'll be some kind of stay. But, how do you, when you're on something like that is really more of a social determinant of health oriented thing that isn't sort of, it's more controversial. How hard is it to fund that?
There's specific funds just for abortion care. And so I'm happy to connect with you after and let you know, especially Grand Challenges Canada has a whole sector where they're looking to fund abortion clinics. And so there's a lot of interest. You just have to find it. It's hard to find, but I can help you navigate that.
Terrific. All right, and this gentleman here, right, son?
So our family office would ask the question, how many funds have you had? And what's the track record? Or is this first funds? And that's very important to investors to look at. What's your track record? What have you done? And your visions are terrific. Your enthusiasm is wonderful, very contagious. But the issue is, what's your track record and where are you going?
Sure, so I can answer first. So we just are closing up our first fund for Fem Health Ventures. In terms of track record, so of course for this fund, we don't have much that we can show, but personally, as I mentioned, I've been investing for 24 years and I have an extensive track record across healthcare companies, including within women's health specifically, across both the private as well as the public markets. So that's generally what I speak to when I'm talking with potential investors, and we look forward to, for future opportunities, being able to talk more specifically about our track record out of this current fund.
How big is your fund, the first fund you're closing?
So we're closing over 30 million.
And for us, we are our first fund. We manage 73 million AUM. We've so far invested in 16 companies that have $5 billion in ARR collectively, created over 2,000 jobs, saved the lives of over 1 million women. And so we're really excited about where we're going with the trajectory and the momentum that we have in women's healthcare. Within those 16 investments so far, we've reinvested in 7 of those companies, and none of them have gone out of business. And so we're really excited, that these companies are continuing to grow.
Thank you.
How hard is it to say you're under 100 million when a family office is going to look at somebody who's got, $1 billion or a $5 billion fund?
Well, what's interesting is I was also an angel investor, so I have 20 personal investments, so I use that as my track record as well. But what I think family office is really important to know is that you're not going to usually get somebody on their second or third fund over $100 million that looks like us, because there's 0.0006 Black women running funds, right? And so we basically are a rounding area that doesn't exist. I don't exist. And so to find somebody on their third fund, even second fund, over $100 million is tough. But that's why you have to believe in us early and invest in us early, because we do have the backgrounds to do these things. We just haven't been given the opportunity. So many people of color and women have been shut out of venture capital for so long. So we need family offices to be able to take that risk and to let us show what we can do.
I think we have a woman in the back.
Hello, my name is Rupan. I am an OBGYN, an abortion provider, as well as a founder of a femtech organization. And I actually have a question related to abortion as well, what I'm working on. And I'm very curious, as someone who's worked in a lot of complex settings as an OBGYN, some of the worst countries in the world, and that innovation you were chatting about the fetal monitor. When I was in my early days as a founder, I was working on something similar in Malawi. So my question for you is that as folks that are investors and wealth holders, and I want to take the conversation beyond the United States, is that what responsibility do you feel in terms of founders that you are supporting with these promising solutions like this fetal monitor, which I think I've heard them pitch, and I think it's an amazing product, to getting these solutions to support countries that could immensely benefit where maternal mortality is, some of the highest, like Malawi, like Nigeria, where I have worked. So that's one question. And then the flip side, I've met a lot of your founders, like Amy from 28 Health, and absolutely love them. And I run a not-for-profit social business at the moment. Potentially we'll set up a for-profit, but I can see a lot of values in bridging for-profit founders with not-for-profit founders. And so what kind of responsibility is there in you as the investors and the wealth holders in terms of supporting or kind of guiding your founders to think about this? Because some of these problems are so complex, like the abortion space. Why not partner with somebody who is doing that work in a way that they can do it in a more risky way that maybe a for-profit could not?
I'll take the first if you want to take the second.
Sure.
So I totally agree with you, and that's why I was just joining the Eisenhower Fellowship Program, where I was just in Rwanda kind of helping them think through their women's health strategy, helping them think through what can my portfolio bring to you, and how do we make it in a way that's economical, that we can have in emerging markets. Because health system, it's very hard to adapt things that we have in the US to other countries, but some of the devices, like you said, and some of the products can be effective over there. And so I've been spending a lot of time in Africa. I went to Spain to kind of see how they're treating their refugees when they're coming in, because they have a lot of health concerns. So I have been actively going around the country kind of trying to see how our solutions can help global matters.
Yeah, I would agree with you as well. And what I would say is the United States has for many years been on the cutting edge of innovation within healthcare, and we will continue to do so. And it's part of our responsibility when innovations are created here in the United States that they are later brought to the other countries around the world. And sometimes it's not in the exactly same form, but in some form that would substantially improve the lives of those around the world. So we look to encourage the companies that we're working with to think about broader applications, not just, how is it going to work in the US market, but how are we going to get this same product and this technology available to people around the world. I think part of your other question was working with nonprofits. So what I would say there is there's been a trend where nonprofits, some of these nonprofits have their own venture arm or thinking about investing in companies, and that's really exciting for us because some of these companies can get investments not only from venture firms like us, but also from a nonprofit, either their venture arm or some other vehicle where they can make a direct investment in a company. In fact, the company that she and I, Radiant Oximetry, that we are both invested in, recently got funding from the March of Dimes, which is traditionally a nonprofit, and they got an investment from them as well. So we're very excited about this type of access to capital that companies that are looking to innovate sort of from the capitalistic mindset, but at the same time who are doing good for society and their ability to tap into that capital.
I wonder about that because there are, wonderful products, wonderful therapeutics and treatments. But if you're on Medicaid, it's hard to get access to that because they may not cover it. Or if you have, just a basic plan on the exchange, it might not be on your formulary as well. So how do you, I think that's part of her question, how do you bring in nonprofits to try to help boost access and equity?
So part of what I would say there is that the types of companies we're investing in, they're good for everyone. So they're good for the health plans, they're good for the health systems, and they're good for the individual
But will
patient.
they pay for it for patients who are not, necessarily have the top tier insurance plan?
Absolutely. So those are the types of companies that we're looking to invest in. So I think, so there's another company that we're invested in. It's a company called Nimble. And specifically, they've developed an app to improve balance and prevent falls in older adults. And this is a women's health category because if you look at all the older adults that present to emergency rooms every year in the United States due to fall injury, 70% are women. And women tend to have worse injuries than men, partially because of postmenopausal osteoporosis. So this company falls into our mostly and differently in women category. So this is a great example of a company where it's good for the patients and the health plans will pay for it. So this app called Nimble is sold directly to Medicare Advantage plans, and they're now speaking with Medicaid plans as well for the purpose of improving balance through a simple daily, 10 minutes a day app. It's a basic physical therapy technique that's proven to work, but it's just not practical for people to go to a PT and going back and forth, especially for older adults who may or may not have access to transportation. So this is in the palm of your hands, 10 minutes a day, gamified, and Medicare Advantage, and now they're speaking with Medicaid plans, will pay for it because they save money. Every time an older adult has a fall injury, it's about $15,000 in cost for the insurance plan. So versus paying for them to have access to a relatively cost-efficient app, it makes a lot of sense for them to pay for it. And what I would add to this is that it works. In fact, this specific app, one of their customers is the country of New Zealand. In the country of New Zealand, everyone's on the same healthcare plan. So it's not like the US where people switch plans year to year sometimes, they forget to sign up sometimes. So you have great longitudinal data. And what they've been able to show is that you have over 30% reduction in falls due to use of this app. They were so excited, in fact, that the country of New Zealand is an investor in this company as well. These are the types of opportunities that we find extremely compelling. It makes sense for the patient, it makes sense for the provider, and it makes sense for the payer. And those are the ones that we feel are the most promising going forward.
So we only have a few minutes left. I'd like to get your thoughts on when do we move beyond women's health investors being a niche, nice thing to do? It's like part of our DEI investing, and people really, digging in and really believing that this is more than a nice to have.
Exits. We just have to show that we can build billion-dollar companies that can exit and make returns for investors, because that's really what people are doing when they're giving you your money. When these family offices are investing, they want returns. Right? So some prioritize impact and returns, but I think that's when we're going to stop being niche. So right now, I'm in the woman bucket or I'm in the minority bucket, but for the first time, somebody said, you know what? We're now going to invest in you out of our real healthcare bucket. And that's where all the money is. That's where the billions of dollars are, and not the tens of millions of dollars that we have to split upon a bunch of emerging managers or black managers or women. But the day that you can take us out of this little box that you put us in and put us in the larger bucket, we'll be able to make those returns and show you that we can capitalize on those opportunities in a bigger way.
Yeah, I would agree with that. I think the timing is now. It's in the near future, in the next 5 to 10 years. If you look at, so I mentioned I've been investing for a long time. 20 years ago, there was no panel like this about women's health. Occasionally, you'll come across a company about women's health. I've been attending early stage healthcare conferences for years. 10 years ago, I'd attend one and have maybe one women's health company on my schedule. This year, I attended the same conference, and there were 25 women's health companies on my schedule. In the last several years, there's been an explosion in innovation within women's health. And we can see it all around us. There's this many people on this panel. Listening to this panel about women's health, broadly speaking.
And this very well-versed audience.
Yes, exactly. Yeah. Exactly. So I'd say so many more individuals, the society as a whole is thinking critically about women's health and what can be done here. And in parallel, we're seeing an explosion in innovation. So we are well poised to see a substantial uptick in these companies succeeding, bringing forward their products, and we're excited to be part of this explosion in innovation.
And I think one of the reasons we're seeing more innovations is because there's more of us. There's actually people to give them money, when before they were like, well, I have this great idea, but I'll never get the money. But when they see more of us, and they see more of us in the room saying, we're going to invest in these types of solutions, we believe that they're important, we believe that they can make money, then we're going to encourage naturally and organically more innovation in the space.
And are you planting the seed in graduate students? We know a lot of companies that are founded by people who, didn't finish at Stanford, didn't finish at Harvard, and somehow they managed to make things work.
Yes, and we have a lot of relationships with graduate schools, Yale School of Medicine, Harvard. It's getting the great academic. There's so much great stuff just in these schools that we're trying to figure out a bridge to make them commercialize. And that's really the problem, right? Because we want the smartest, brightest minds working on the hardest challenges, and we want to be able to get that to market. Because right now, there's so much innovation just stuck at these colleges.
We have a Fem Health Fellows program for current MBA students to do exactly that, to get them excited about venture capital and women's health specifically. So we're on our 4th cohort from a variety of business schools across.
And they're women and men.
They're women and men. Most of the people who joined have been women, but we've had both men and women who are interested in the program. And I think that's part of it. It's not just women that are interested in this. It's everyone, men and women that are interested and excited about the opportunity here within women's health.
Well, thank you, ladies, so much for a wonderful discussion, and I hope folks do come up and connect with you.
Thank you.
Thank you.